Hi, my name is Dorian Kramer. I'm a doctor of acupuncture and Chinese medicine, and I specialize in treatment of psychiatric disorders, focusing mostly on post-traumatic stress disorder, chronic post-traumatic stress disorder, and a condition called developmental trauma disorder, as well as other somatoform disorders that are usually associated with these conditions like chronic pain. I've been treating these conditions for about 14 years, and my journey here began in the beginning with starting to see more and more psychiatric conditions associated with many of the physical conditions my patients complained of. And it became very apparent when I started treating a large veteran population in my practice. Now, for me personally, things were also very poignant. I always knew that my upbringing hadn't been that great. My parents tried to kill each other on a regular basis in front of myself and my sister up until their divorce. There was a lot of bullying when I was younger, and I put myself in a lot of hairy situations as I grew up. Now, for whatever reason, reasons that will become apparent later in the series, if you choose to follow the series, I always thought I kind of had it good, though. I was managing stuff. I managed to get through my day. I may have not been very happy. I was suffering from a lot of chronic pain and a lot of digestive issues. I also found myself, I was very isolated quite often from people. I never understood why. I figured that was just me. Some people are meant to be isolated. However, about 8 years ago, I was suffering from a lot of health issues, and I was married. I had a daughter, another kid on the way, and I realized, most of the time, I didn't want to go out. My wife would want to go do stuff. I would always intend to, and then my pain would flare up, or I'd get really exhausted. My temper was terrible. I was probably drinking too much. I was probably eating too much. And then I decided to address some of these Western medical conditions through diet. But at the same time, I got this polarity treatment. Polarity therapy, if you haven't tried it, is a bodywork technique that can be used to break a lot of emotional barriers loose. I had the guy do one of those treatments on me, and I nearly had a nervous breakdown. I was very suicidal after that. So, what I discovered was a series of repressed memories about psychological and physical abuse from my father and potentially some from my mother. Not all of it became completely clear. So I was desperate to figure out what was going on. First thing I did was someone turned me onto a book called The Body Keeps the Score by Bessel van der Kolk. While I was reading it, I finally got to a section where I realized that I wasn't special in all my physical and emotional trauma. I was textbook. So I began to investigate how these conditions can affect health. Not just mental health, but physical health, what we consider more physically oriented health. Part of what I noticed was that many of my patients who had rheumatoid arthritis, all after one or two sessions, revealed a history of severe sexual or physical abuse as a child. I could explain this through Chinese medicine, through the idea that emotional states are just qi, too much qi is heat, and that would progress that. But I knew there had to be more. And then I looked at further research by Dr. van der Kolk, and I found his study that showed that, yes, rheumatoid arthritis in the patient population that they chose had a definite link to rheumatoid arthritis. Rheumatoid arthritis had a definite link to physical and sexual abuse. So I began to do further and further research, and what I found was there is a ton of information, not just from the Eastern or Chinese medicine approach, but from Western medicine and research, specifically in the fields of like psychoimmunology. And what we're starting to learn is that much of our, what we consider our physical health, is completely connected to our emotional health and how we process stress. Now, Chinese medicine, at its beginning stages, when it discusses the basic creation of disease processes, talks about what they call 7 emotions or 7 affects, and those being the progenitors of most disease. Other things are exterior attacks, like colds, but even those can be linked to our interior landscape. And then dietary functions, lifestyle can be linked to it. But the emotional states were always the primary in Chinese medicine. Now the research in Western medicine and Western research is showing that yes, how we process stress may be the #1 reason for many of our health disorders. That's not saying you can eat like crap for the rest of your life. But what I am saying is that these conditions are definitively linked to how we process stress. So 1995 to 97, Kaiser Permanente and the CDC did a longitudinal study in which they had basically a number of patients, a large patient population, who had been getting regular treatments at clinics. And they got these patients to fill out a questionnaire. And this questionnaire was looking at what they referred to as ACEs. It's called the ACE study, and that's Adverse Childhood Experiences. Basically, it was a questionnaire that would look at everything from personal trauma, as in a child who experienced sexual, physical, emotional, nutritional abuse, to also witnessing sexual abuse or physical abuse of a sibling, of a parent, watching parents who were addicted to drugs or alcohol, being homeless, having financial insecurity. And they found 3, I would say primarily, most interesting facts. Now, they suspected, obviously, that with a background like that, you would see links to, in adulthood, issues with drug and alcohol abuse, depression, anxiety, difficulty holding relationships, difficulty holding a job. However, what they didn't know was that they would see a lot of links to what we consider, for want of a better term, more physical diseases. Diseases like cancer, high blood pressure, cardiac conditions, often what's called metabolic syndrome, hypothyroidism, and so on. Also autoimmune disorders, well, like rheumatoid arthritis. What they also found was this condition is what they call dose dependent. What that means is that if someone checked off 1 box on the ACE study or the ACE questionnaire, then they had a certain amount of disease process in their life. The more boxes they checked, the more disease processes they had. But the last part, which was also interesting, is that this was much more prevalent than they ever expected. A majority of the people were responding that they had these experiences. Now, we know other research has shown that 1 out of 4 girls are expected to have been sexually abused in their lives or will be. 1 out of 6 boys. We know that there are statistics that say 70% of people have undiagnosed anxiety. At any one time, 50% of people can be depressed. We also know that all these numbers are completely underreported. That means, and vastly underreported. So that means the 1 out of 4 could be 2 out of 4, 3 out of 4, 4 out of 4, the majority. The boys, maybe 2 out of 6, maybe 3 out of 6, maybe more. What we're seeing is that conditions like, let's just call it developmental trauma disorder, for want of a better term, or for a blanket term, may be an epidemic in our country, if not a pandemic in our planet. And this is leading to many of the disease processes. So, the reason I am doing this talk, doing this video, and starting this series is what I want to do is take you through the explanations in Chinese medicine, how Western medicine views these and the research behind it, take you through the various treatments available out there, whether it's massage, yoga, EMDR, bioneurofeedback, regular talk therapy, meditative techniques, and try to find you the best possible combinations, because these conditions don't respond to one treatment. There's no one treatment that cures this. It is a number of treatments. It is a process that has to go with the individual. But I'm also going to take you through maybe some of the treatments that seem like they should help and they won't. Or even treatments that will help during a certain time period, but then stop helping or may help again later on. I also want to take you through some of the dangers of treatments, ones that have some serious side effects. Take you through the very effective techniques of meditation and acupuncture, and also the dangers maybe associated with meditation that a lot of people don't talk about. So I hope you'll join me on this journey. Now, I can't promise you that you can be completely cured with this. And I'm guessing that if you're following this, it's not just because of curiosity, it's probably because of personal interest. But I can tell you that from the beginnings of my process in this to now, the difference is vast. You can get better. You can heal. 100%? I don't know. But you can get to your best possible life, and a life that's much more functional, not terrifying, and not filled with pain. And I can promise you that I will give you every piece of information I can to help you on that journey. So I hope you'll join me. I'm going to do a series of lectures, and hopefully you'll listen. Thank you for your time today.